Hi, everyone, to all of you. A very good evening. We are just over with our NEET MDS exam. So, I just want to know how many of you are online through this YouTube chat. So, in case you people are there online, you can just send me hello or hi. Okay. Hi, everyone, to all of you. Right. So, guys, I can see there are around 11 people who are there online. So, guys, we are going to discuss this recall of this pharmacology. So, I will not waste much of your time because you people are already fed up with studying so much. Yes, Dr. Sayed. Dr. Sayed, hi, Dr. Sayed. So, guys, like whatever feedback I have got from a student, according to the students, the difficulty level of the paper is from medium to difficult. Like we will not say the paper is easy. So, the difficulty level was medium to difficult. It is not very easy. It is also not very difficult. And state one-liner questions were not there. So all questions or most of the questions were clinically based questions. So they have given you clinical scenarios and they have asked you mainly the management of this acute emergencies that you can come across while doing a dental procedure. So it was clinically based questions. They are not there were no one-liner questions, and medium to difficult was the level. And as expected, the topics which were covered, like most of the time, they have covered the topics of acute medical emergencies. So topic of acute medical emergencies they have covered number one topic. Number two, they have covered about antibiotics or antimicrobials, you can say. So antibiotics, antimicrobials, second topic they have covered. Third topic they have covered, apart from acute medical emergencies, antibiotic, antimicrobial. The third topic they have covered is regarding uh, the central nervous system. So they have asked about the toxicities. They had asked about the central nervous system and anesthesia drugs. So anesthesia drugs and few toxicities of CNS they have asked. So anesthesia drugs they have asked, toxicities they have asked, antimicrobials they have asked, acute medical emergencies they have asked. So there were no question from general pharma. So general pharma they did not ask this time, and also there were no question from the standard topics which is usually asked in the exam, like endocrine. There was a no question. So they have specified themselves. They have just concise themselves on these few topics only. So let's start with the first question. So the first question is based on ACLS algorithms. So advanced cardiac life support algorithm. Advanced cardiac life support algorithm. So guys, if we talk about this ACLS algorithm, there were total four algorithms. There are total four algorithm of this ACLS. First is of CPR. First is of CPR. So CPR uh, is the first algorithm. The other algorithm is of bradycardia. So which drug is used in bradycardia algorithm of the advanced cardiac life support? Third is cardiac arrest. So third is what is the management of cardiac arrest? And the fourth is what is the management of supraventricular tachycardias? Supraventricular tachycardia, which is shifting to ventricle, that is paroxysmal type. So paroxysmal supraventricular tachycardia. So these are the four algorithms which comes under advanced cardiac life support. Now the patient of cardiac arrest can come to you with four types of presentation. So patient can have pulseless ventricular tachycardia. Patient can come to you with pulseless ventricular tachycardia. Patient can have ventricular fibrillation. Patient can have pulseless electrical activity, and the patient can also have asystole. So there are four types of presentations that we know that are cardiac arrest presentation: pulseless ventricular tachycardia, pulseless electrical activity, ventricular fibrillation, and asystole. Now, guys, for your surprise, they have asked three questions from this ACLS. Like all these three algorithms they have asked this time in your exams. I don't know why these people are fond of asking this ACLS so much in detail. So the first question is based on this bradycardia. So what is the answer, guys? So bradycardia, drug of choice you will mark is atropine. So atropine is the best medicine that you will mark over here. So atropine is a medicine that you can mark if a patient has got bradycardia in the dental chair. So the starting dose of atropine is 1 milligram. Maximum dose of this medicine you can give 3 milligram. So starting dose 1 milligram, maximum dose 3 milligram you can give for the bradycardia, right? Now, if you see the second question they have asked on pulseless ventricular tachycardia. So if they have written in the question also, like according to the ACLS guidelines, which medicine we can use for pulseless ventricular tachycardia? So this question is based on this cardiac arrest. So question is based on cardiac arrest. So medicines given for pulseless ventricular tachycardia, right? Pulse, ventricular fibrillation, asystole. So we have to give a medicine that is adrenaline. So adrenaline is a medicine that can be used. So the drug here is epinephrine. So adrenaline is also known as epinephrine. So adrenaline and epinephrine is a medicine that is a drug of choice for all these four conditions, which is collectively known as cardiac arrest. Pulseless ventricular tachycardia, pulseless electrical activity, ventricular fibrillation, and asystole, the first medicine to be given along with a shock. So we have to give a shock. Along with the shock, we will give adrenaline. So shock is particularly given for these two conditions. Shock is typically given only for two conditions, pulseless ventricular tachycardia and ventricular fibrillation. But in other two conditions, like in these two conditions, we don't give any shock. So shock means the electric shock. So along with the electric shock, the question was exactly like this way. Along with the electric shock, which medicine is given to a patient of pulseless ventricular tachycardia? So the answer was adrenaline. And guys, the dose of the medicine is 1 milligram. So the dose of the medicine is 1 milligram. So 1 milligram is the dose that is given to a patient. The concentration of drug is 1 is to 10,000. So 1 milligram is the dose, concentration 1 is to 10,000, and the medicine is given by either intravenous route or by the intraosseous route. So 1 milligram drug, 1 is to 10,000 is the concentration. We can give the medicine dosage intravenous or by intraosseous route. So here the answer is, like they have asked, the pulseless ventricular tachycardia. So the answer you can mark here is epinephrine. So epinephrine is the best answer to be marked over here. Now, in case the epinephrine is not able to control, like in next year, this question is repeated. In case this question is repeated next year, then the second drug you will mark after this is amiodarone. So the second drug that we can use over here is amiodarone. In case amiodarone is also not given, the third medicine is lidocaine. So these are the three medicines they have asked this year, right? So adrenaline is the first medicine to be given for pulseless ventricular tachycardia. Second drug that we can use over here is amiodarone. The third medicine we can use over here is lidocaine. So these are the medicines that we can use for pulseless ventricular tachycardia. Now, if a patient has come to you with this problem of PSVT, so which medicine we can use for the treatment of PSVT, that is paroxysmal supraventricular tachycardia. So here the answer is adenosine. So adenosine is the medicine that is used for the treatment of pulseless ventricular tachycardia. Sorry, paroxysmal supraventricular tachycardia. So here the first dose of the medicine is 6 milligram and the second dose of the medicine is 12 milligram. First dose 6 milligram, second dose 12 milligram. So adenosine is the answer of the question number 3, where they have asked this question. Patient develops supraventricular tachycardias. Patient develops supraventricular tachycardia. Which drug can be used? Which drug can be used to prevent paroxysmal transfer to the ventricle? So they've asked this question, which medicine I can use so that this tachycardia should not be shifted to ventricle? So here the best answer you have to mark is adenosine. So they have asked three questions on ACLS algorithm. There are total four algorithms and they've asked three questions from this algorithm. So this is something unjustified, but still like as an examiner, they want, as a dentist, you people should be knowing how to manage this medical emergencies. That's why they have put questions, three questions on this ACLS algorithms. Guys, in case you find that any option is was not there in the question, and in case you think that question was not asked in the exam, please let me know in between, because I'm reading your chat side by side. So I can see Dr. Sayyed, Dr. Anurag, Dr. Nitika Bora, Dr. Shailesh, Dr. Pankti. I'm able to read your messages. So in case guys you think these questions are not asked, or the questions are asked in some other manner, or maybe these options were not there, some other options were there, let me know. Accordingly, I will change the options and tell you the, if possible, I will also tell you the answer of that particular question. So question number one, the patient got bradycardia in dental chair. Which drug is used? Answer was atropine. Second is, according to the ACLS guidelines, which is the best medicine for pulseless ventricular tachycardia? Answer was epinephrine, right? Now the third question is, patient develops supraventricular tachycardia. So which drug can be used to prevent the paroxysmal transfer to the ventricle? The answer was adenosine. Now, guys, let's talk about the question number 4. So we talk about the question number 4. A male patient aged 45 years. So a male patient age 45 years. You can see the patient is male. Uh, I think I have lost the connection with you people. So patient is male whose age is 45 year. Patient has come to an OPD with a history of alcoholism. So patient has a history of alcoholism, plus patient is also drowsy. There is a respiratory suppression, maybe breathlessness is also there. Patient is also having the meiosis, plus patient is addict of morphine. So patient is also addict of morphine. So which drug will be given here? So guys, if you see the various indications, like if you read this presentation, patient respiratory center is down, patient CNS is also down because patient is drowsy, respiratory center is down, plus the patient is getting meiosis. Now, meiosis is something that is typically seen only in opioid poisoning. So this is a morphine addict patient, and his patient is taking alcohol also. So both morphine and alcohol can suppress the central nervous system. They can suppress the respiratory center also. So this can be a case of morphine poisoning. So they ask the antidote. So antidote of choice is naloxone. So antidote of choice here is naloxone that is given to this patient who is a 45-year-old male, comes to an OPD with history of alcoholism, drowsiness, respiratory suppression, right? So we can use this uh, naloxone as an antidote. Now let's talk about question number 5. So we talk about question number 5. So this question was based on local anesthetic medicines overdose. So patient has taken local anesthesia drug and patient has taken the overdose of this medicine. Now, what will be the presentation? Like how this anesthesia overdose will be presented to you. So, guys, you must be knowing whenever we have the local anesthesia overdose, so this is going to affect your cardiac system as well as you are going to affect your nervous system. So initially the patient will start having the loss of sensation in the around the lips. So the first symptom is when the patient will have the loss of sensation on lower lips or around the lips. It's the first symptom of local anesthesia overdose. So you have given anesthesia drug somewhere else, but you're getting the anesthetic effect on your lips. This is the first presentation of your local anesthetic overdosing, right? Plus your heart rate will go down because the local anesthetics block sodium channel in heart. When they block the sodium channels in heart, the heart rate will go down. Now guys, after that the local anesthetic medicines will enter your CNS, and once these medicines will take entry in CNS, these medicines block sodium channel in CNS. So local anesthetic medicines block sodium channel in CNS and they inhibit your inhibitory pathways of CNS. So these medicines can inhibit inhibitory pathways of CNS. So they can inhibit inhibitory pathways of CNS, and when you block the inhibitory pathways, your CNS gets stimulated. So CNS gets stimulated first of all. So whenever the CNS is stimulated, the first sign of toxicity is tremors. So tremors is the first sign that when you come to know the patient's CNS get involved, and if you will not stop medicine at this point, you can have the frank convulsions. So tremors can occur, convulsion can occur. This is the first presentation of the CNS toxicity. But even then, if you keep on giving the dose to this patient, ultimately all CNS centers of the patient will go down. So patient respiratory center, patient vasomotor center, everything will go down, and ultimately patient will die. So ultimately patient will die, right? So this is the presentation. So when you block the sodium channels in central nervous system, so what is the first presentation? That is the anesthesia around. Patient will have the loss of sensation around lips. So this is the first presentation. But after that, when the medicine will take entry in heart, it can cause heart block. Medicine can take entry in CNS. This will block the inhibitory pathways of CNS. So in CNS, the first presentation is tremors. Then we have the convulsions, and ultimately all CNS centers will go down and patient will die. So here the local anesthetics overdose will result in post-convulsion depression. So patient will get, well, first of all, patient will get convulsion, then the patient will have the depression. It's not other way around. It's always the convulsion first followed by the depression. So question 5, answer is B, Bombay. Yes, question 5, post-convulsion depression was answer. Dr. Afreen, it's about the toxicity. Okay. So overdose nahi tha. Instead of overdose, the word was toxicity. So local anesthetic medicines toxicity was given. Okay, fine. That's very good. Instead of the word overdose, the word was toxicity, and the answer was post-convulsion depression. This was the answer. Okay. Now, question number 6, patient has undergone some extraction, some dental extraction, because I don't know your the exact technical terms for the extraction. So I've just written extraction. Now, patient has a history of some peptic ulcer disease, right? So, patient has history of peptic ulcer disease, or maybe the patient is having the history of GERD. Now, which analgesic should be prescribed? So, which painkiller should be given? So, guys, we have a COX-2 inhibitors. So we have a selective COX-2 inhibitors. So these medicines which are selective COX-2 inhibitors, these medicines have one very big advantage. These medicines cannot lead to GIT side effects. So these medicines cannot lead to GIT side effects. So patient who has undergone extraction, so we can give this analgesic drug, that is etoricoxib, which is a selective COX-2 inhibitor, right? So we can give this medicine to this patient, etoricoxib, which has no GIT side effect. Here the answer can be paracetamol also. Here the answer can be paracetamol also, but they have asked the analgesic drug and patient has undergone extraction. Maybe patient has got some infection over there, inflammation may be there. So it's better to mark answer as etoricoxib because they're specifically asking that which medicine will not cause peptic ulcer as a side effect. So etoricoxib is a better choice to be chosen over here instead of the paracetamol. So etoricoxib is a better painkiller, more efficient painkiller here instead of the paracetamol. So according to me, the answer should be etoricoxib, but this is highly controversial question. Like if I would sit in America, I would sit in USA, then I will prescribe paracetamol. If I will sit in India, I will say etoricoxib. But better answer is etoricoxib because this medicine is more efficient drug. So if you have to choose the better drug, so more efficient drug you can choose here. So etoricoxib is the better answer to be marked. Now question number 7. Now patient during emergency, doctor has used a drug diazepam. So during emergency, so again the question is based on emergency. So doctor has used a diazepam to control a serious clinical condition. Now who will tell me which clinical condition would it be? So this clinical condition could be seizures. So diazepam doctor has used for the treatment of a serious clinical condition. So, which is a serious clinical condition for which diazepam as a drug can be used? So, the answer is seizures. Seizures is a condition. Epilepsy is a condition for which we use diazepam as a drug. So, diazepam is a medicine is which given for the treatment of seizures. So, if question is come to you, what is the drug of choice for acute seizure? If a question is ever asked to you, what is the drug of choice for acute seizure? You will mark the medicine as lorazepam. So, lorazepam is the best medicine. Second best medicine is diazepam. So lorazepam is the best medicine and diazepam is the second best medicine. Why in America paracetamol? Because in America they always start with paracetamol. That's why. Dr. Rani, there is no specific answer for this, but because in for Western countries we usually start with paracetamol as a painkiller. But see, this is the previous question was controversial question. This is what I am telling you. So according to me, the answer is toricoxib. Okay, so Dr. Anil is saying the question was analgesic prescribed once a day. Okay. Yes. This is what I said because patient is undergoing extraction, Dr. Sayed. So patient wants anti-inflammatory coverage also. This is what I want. This is what I discussed because during extraction we can have the inflammation also and paracetamol is not a good drug to treat pain and fever during inflammation. So inflammation can lead to pain and fever and paracetamol does not cannot be given for the pain and the fever due to inflammation. Paracetamol is not effective if the inflammation is present. That's why I'm choosing here etoricoxib, right? So paracetamol we can rule out on the basis of that the patient is undergoing extraction, maybe some infection is there, maybe some inflammation is there, and paracetamol cannot treat the pain and fever that is due to this inflammation because paracetamol does not have any anti-inflammatory property. Okay, so status epilepticus. So according to Gaurav Sharma, instead of seizure, they have given the option as status epilepticus. So this is also correct. So if the patient has status epilepticus, if the patient has status epilepticus, again, Dr. Gaurav Sharma, answer is same, lorazepam. So lorazepam is a better medicine than the diazepam. So in MCQ, in that was asked in your exam, the answer was in MCQ, they have given diazepam. But overall, the best medicine is lorazepam. Overall, best medicine is lorazepam, but in your MCQ, they have given the diazepam. Okay, so question number 7, answer is B Bombay, that is status epilepticus was the option. So we give diazepam for status epilepticus. Now question number 8, patient suffer from lung cancer and patient is taking chemotherapy drug. So patient for the lung cancer taking chemotherapy drug. Now that chemotherapy drugs, one of the drug is dihydrofolate reductase inhibitor. So there is a drug which is dihydrofolate reductase enzyme inhibitor. So they've asked you which medicine is dihydrofolate reductase enzyme inhibitor. So here the answer is methotrexate. So methotrexate is a medicine that is the best medicine, the best answer over here. It's a dihydrofolate reductase inhibitor, and for the prevention of its toxicity, for prevention of its toxicity, for prevention of its toxicity, we can give folinic acid. So for the prevention of methotrexate toxicity, we give folinic acid along with this medicine. So methotrexate is a medicine that is a dihydrofolate reductase inhibitor given for the treatment of cancer, and for the prevention of its toxicity, we can use a medicine folinic acid. So question 8 answer is A. Acha, Dr. Anurag is saying in MCQ, status epilepticus was not there, seizure was given. Okay, Anurag and Gaurav Chaudhary, whatever is the option, देखो दोनों ही seizure disorders है. Both are seizure disorders. So whether they have written seizures or they have written status epilepticus, it's fine. Like the diazepam is given for that only. Okay. So no argument because it's a time for enjoyment. You have just done with your exam. So I will not take much of your time because recall question में क्या रखा है यार? You enjoy your life now, right? Question number 9. So question number 9, a patient was admitted in ICU. So again, the emergency condition. So patient is admitted in ICU with altered sensorium and patient fever is 102, very high grade fever, because more than 101 is a severe high grade fever. It's a high grade fever more than 101 with deranged vitals and nuchal rigidity. So this is typically a case of meningitis. So they have given a case of meningitis and they have asked you which medicine can be used. So guys, whenever we have to give this medicines, we give this medicines combination third generation cephalosporin with vancomycin. So third generation cephalosporin with vancomycin is the best combination. So please remember when the patient age is less than 55 years, patient age is less than 55 year and the patient is immunocompetent. Patient immunity is well preserved, like patient is healthy, patient has got meningitis, patient age is less than 55 year. We give combination of cephalosporin plus vancomycin. So third generation cephalosporin is given. Third generation cephalosporin. We can also give fourth generation also. There's no harm. So third or fourth generation cephalosporins are given along with vancomycin. So here the cephalosporin will cover gram-negative bacteria and vancomycin will cover MRSA. So we have to cover all the spectrum. So cephalosporins will cover gram-negative and to some extent gram-positive bacteria also. Vancomycin will cover MRSA. So this is the combination that we use for the treatment of uh, meningitis in a less than 55-year-old patients who are immunocompetent. But if the patient age is more than 55 year, patient age is more than 55 year and the patient is again immunocompetent. Patient is immunocompetent. Now here you will also cover listeria. So listeria infection risk is increased. So you will use the same cephalosporin, generation 3 or 4 cephalosporin along with vancomycin, but here you will add ampicillin. So ampicillin is an antibiotic that we will add in age more than 55 years, right? So age 55 year, we will add ampicillin. So ampicillin is a drug that we will add to cover the listeria. Now guys, if the patient is immunocompromised, if the patient is immunocompromised, then the answer is like in this MCQ, if the patient is diabetic, patient is immunocompromised, then we will use generation 4 cephalosporin only. We will use generation 4 cephalosporin plus vancomycin plus we will give ampicillin. So this is the recommendation for the treatment of meningitis. Dr. Anshul Tayal is saying in this question the word leptomeningeal involvement was mentioned. So leptomeningeal involvement. So leptomeningeal involvement is associated with cancer. So was there any history of cancer? Was there any history of cancer given? Because leptomeningeal involvement means patient may be suffering from cancer. So I have to recheck this question because leptomeningeal involvement, usually we don't give this type of antibiotics. There must be something else. Uh, I mean, leptospirosis to nahi tha, like this, all these things need to be confirmed because leptomeningeal involvement if given, so there must be some associated cancer and accordingly we give the treatment. So it's difficult to mark the answer here. So overall, if the meningitis is there, so I'll come back to this question again in case guys you will come to know the exact question. Till the time, question number 10. Question number 10, penicillamine is used as an antidote of some metal poisoning. What is its role? So guys, please remember, it can increase the elimination of copper. It can increase the elimination of copper right? So increase the elimination of copper. Yes, okay. Penicillamine is given in Wilson's disease. Yes. So Wilson's disease is a disease where the copper will accumulate in the liver. Like copper will come to the liver, and after that the copper should go to the bile duct. So copper should go to the bile duct, and through this bile duct the copper should get eliminated out of the body. So what is the problem here? The copper cannot get eliminated. Copper remain in the liver. And when the copper will remain in the liver, this will cause damage to the liver. So copper will damage the liver, and now after that the copper will spill back to the plasma. And when this copper will spill back to the plasma, it will go to the CNS and can result in CNS toxicity. So this is a Wilson's disease. So guys, please remember the drug of choice for Wilson's disease is zinc. So zinc is the overall drug of choice for Wilson's disease. So zinc is the overall drug of choice for the Wilson's disease. We can also use the medicine like trientine. So trientine and penicillamine, these medicines can also be given. So trientine, penicillamine, these are the other two copper chelating agents that we can use for Wilson's disease. I don't know why they have asked so much CNS this time. They've asked CNS, right? So zinc is overall a drug of choice, is the best chelating agent for copper that will help in the elimination of the copper. We have the other medicines like trientine and penicillamine. So they will help in increase elimination of the copper. Or we can say the answer is D Delhi. So according to students, they have given the name of the disease also. Like they have said that penicillamine is an antidote of the copper overloading or the Wilson's disease. What is the role? So it is help in increase elimination. Yes. So cancer pe there was a question I told you. Methotrexate they have asked. In cancer they have asked methotrexate this time. TB was not asked. They have asked antimicrobial. They have asked central nervous system. Like this question was from central nervous system, Wilson's disease, right? Okay. So Dr. Adarsh Mishra is saying they asked the empirical antibiotic before the susceptible testing of meningitis. Yes. Like in meningitis, we have to do the lumbar puncture. So lumbar puncture we have to do, we have to take out the cerebrospinal fluid for the culture. We take out the sample for the cerebrospinal fluid for the culture. And when we send this it for culture, then we come to know which bacteria get involved. Accordingly, we decide the treatment. But till that time, the culture report will not come because culture report will take 3 to 4 days. So till that time, the culture report will not come. We start this combination, cefotaxime, or ceftriaxone, whatever was given, plus vancomycin. So this combination is usually given, right? Okay, question number 11. They have asked the patient has got acute attack of asthma during the extraction. So during the extraction, patient has got acute attack of asthma. Now, which medicine is used for acute attack of asthma during the extraction? So here the answer is salbutamol. So guys, please remember salbutamol is a short-acting beta-2 agonist. It's an easy question. It's a short-acting beta-2 agonist medicine, salbutamol. And this is the medicine which also has the fast onset of action. It's a short-acting beta-2 agonist having a fast onset of action. So if the question is asked to you, what is the drug of choice? What is the drug of choice for acute attack of bronchial asthma? So guys, these days we give combination of formoterol. So these days we give combination of formoterol plus budesonide. So in case formoterol plus budesonide combination is not given in MCQ, you can mark salbutamol. So salbutamol these days considered as second drug of choice. But the best part here is they have only given formoterol. They didn't give you the budesonide in the answer. They didn't give you the budesonide in the answer. So formoterol is given always with budesonide as per the guidelines. In case formoterol is given as a monotherapy, we can rule out this. We can rule out formoterol. So salbutamol we will mark here the best answer. So salbutamol is a medicine that we will give for acute attack of asthma that patient has got during the dental extraction. So question 11, answer is A. Now I'm not sure about these questions. Now after 11 question, whatever question I will display, I'm not sure whether that question is actually asked in the exam or not. So question number 12 is based on HIV prophylaxis. So question number 12 based on HIV prophylaxis. So HIV prophylaxis should be done within 72 hours. So whenever the patient has got exposure, whenever the patient has got exposure, we call it post exposure prophylaxis. Like you are a dental surgeon, while doing the extraction you have got a needle stick injury, you have got a contact with the patient blood, So you are not the HIV positive patient, but now you have got a contact with the HIV positive patient. Now you are the candidate who will take the post exposure prophylaxis. So this post exposure prophylaxis should be started. Post exposure prophylaxis, the moment you will come to know that that the patient is HIV positive and now you have touched his blood. Now this should be started as soon as possible. So this should be started as soon as possible. Best to start within 2 hours. Best to start within 2 hours, but maximum you can start up till 72 hours. So it should be started as soon as possible. Best to start within 2 hours. Like the moment you have got the exposure, you have to give the medicines within 2 hours. Best, right? But in case you are not taking the medicine, you have not taken the drug, maximum you can take up till 3 days, right? So it should be started as soon as possible, right? And best to be started within 2 hours. And okay, Dr. Anshul is saying word preferably given within was mentioned. 72 hours. Okay, 2 hours. Yes, Anshul Tile, 2 hours was the option. Okay, if the 2 hours was the option, it is best to be done within 2 hours, right? But maximum 72 hours. I mean, what is the exact language of the question? Because now there is a confusion because according to students, 2 hour option was also there. According to students, there are option of 2 hours was also there. Now there is a now this question has become controversial because I mean, what you will mark? This is totally a perception. Was this the exact language of the question that HIV prophylaxis is done within, or they have given a clinical case like patient has got an exposure, now patient has to take post-exposure prophylaxis that should be best started. The word best was there. The word best was there or not? So should be started as soon as possible. That's fine. It should be started as soon as possible within 2 hours. Maximum we can start. We are lacking in sense and the grammars. Okay, grammar. So, doctor, this is again a controversial question. Number two question that is controversial, but you will mark HIV prophylaxis done within 72 hours or 2 hours. Like if the word best is given, then you can mark 2 hours, but overall 72 hours. Overall 72 hours. So, according to me, if you ask, like, okay, Dr. Anshul Tayal has given the option. Here, the second option is 6 hours. Second option is 6 hours. One option was 48 hours. Fourth option was 72 hours. So, if you take my opinion, 72 hours will be the better answer because overall, like there is no study which says like in case you start at 70th hour, like in case you have started the prophylaxis at 17th hour, then the patient will going to get the positive. It's not like that. So you can do within 72 hours. The maximum range you can give. Best to start it within 2 hours, right? So 72 hours is the best answer to be given here, right? According, if you take my opinion, like if both options are there, the best answer is 72 hours, right? Again, this is a controversial question. Question 13, patient is on prolonged antibiotic treatment. So patient is on prolonged antibiotic treatment. Nee, Sonia Singh, the best answer according to me, like, because this is totally a perception actually. I mean, there are few questions in exams where the answers are difficult to mark. It totally depends like what examiner was thinking while putting the question. Yes, Dr. Anshul, best is as soon as possible. Better answer is as soon as possible. Within 2 hours you have to start because ये तो है ही है मतलब as soon as possible means within 2 hours. Maximum 72 hours. So the question is very vague. HIV prophylaxis is done within 72 hours. Because if I mark only 2 hours, it means after 2 hours you cannot take prophylaxis. Is it so? After 2 hours, we can take prophylaxis. Is like it is the guidelines that we can take prophylaxis up to 72 hours. So the best word was not given. That's why I will go for 72 hours as the best answer. So the patient is on prolonged antibiotic treatment, developed white patches on tongue. Patient has got white patches on tongue. So which of the following drug can be used? So the answer is this is an oral thrush. So this was a case of oral thrush. It's a secondary infection. It is a secondary infection which patient can get when patient will take antibiotic treatment for a long time. So whenever patient will take antibiotic treatment for a long time, patient will get a secondary infection, patient will get a oral thrush. And initially we start with an local antifungal drug. So initially we start with an local antifungal drug, like we discussed in our class also so many times. We start with clotrimazole. So clotrimazole or nystatin are the local antifungal drug. Usually we start our treatment with local antifungal drug like clotrimazole and nystatin. Now after giving this medicine, if the disease is not controlled, if the disease is not controlled, then we have to give the systemic antifungal drug. We have to give the systemic antifungal drug, and the systemic antifungal drug is fluconazole. And fluconazole is overall considered as drug of choice. So initially we start local antifungal like clotrimazole and nystatin. And if the disease is not controlled by giving the local antifungal, we have to move on to the systemic antifungal drug, which is overall the best medicine to be started in patients of oral thrush, that is fluconazole. So here the question is given regarding the four medicines, all start with C, that is clotrimazole. Dr. Sonia, newborn babies. So newborn babies have different types of totally guidelines. So that is a vertical transmission. That is a vertical transmission guidelines. So vertical transmission means when you want to prevent the infection to occur in the babies. So you can start medicine immediately after birth. So vertical transmission पे question नहीं है. This question was not on the vertical transmission. This is for the prophylaxis that is given. We call it post-exposure prophylaxis. If the question, if you think in terms of prophylaxis given to newborn babies, like Dr. Sonia is saying, vertical transmission is also a prevention that is done in babies, newborn babies. But in that case, they will definitely give you the history of mother, because on the basis of the history, whether mother is on HIV therapy or not, we decide the treatment that is given to the babies. So in case you want to know which treatment is given to babies, we should have the history that mother is taking anti-HIV drug at the time of delivery or mother is not taking anti-HIV drug. Then only we can decide. And that is given up till 6 weeks to 12 weeks. That is also not certain. That is totally depends upon the mother who is taking HIV drugs or not taking HIV drugs. So here the question is typically based on post-exposure prophylaxis, and we give the triple regimen that you must be knowing. So the triple regimen is T plus L plus D, tenofovir, lemivudine, and dolutegravir. Right? So, okay. So clotrimazole, cotrimoxazole is antibiotic, clindamycin antibiotic, clarithromycin macrolides. Oh, Richa, this question this question was easy question, and because if you have confused with the names of the drugs, like I will say it's a bad luck, because this was one of the easy question. I wish the other questions, whatever you have marked, is going to be correct. So my wishes are with you, right? Now, patient undergoing mandibular surgery. Patient is undergoing some mandibular surgery, wants to open the mouth wide. So doctor wants to give skeletal muscle relaxant to relax the jaw muscles. Now, which drug can be used? So guys, we know that mivacurium is a short-acting medicine. Mivacurium is a short-acting medicine. So this is the best option you can mark, because the patient is undergoing a surgery, right? And you want to relax the jaw muscle. So mivacurium is a drug which is a short-acting medicine that you can mark. So guys, I'm a bit doubtful about this question. Was this question there in the exam? And is there any other relevant history is given? Is there any relevant history which was there? Because was there a drug rocuronium given in that? So I'm doubtful about this question. Okay, Pranav is saying there's a question on muscle relaxant. So this was the question on muscle relaxant, Dr. Pranav. So can you recall, like, what are the other informations given in this MCQ? Because this is very vague question again. I mean, it's difficult to find out the best muscle relaxant, because that totally depends upon the duration of surgery. If the patient is undergoing a surgery that will last only for less time, only for a short time, then mivacurium can be chosen. But if the patient is undergoing the surgery for a long time, like intermediate time, like 4 to 5 hours, then vicuronium can be chosen. Patient is undergoing long time surgery, pancuronium can be chosen. So any idea, guys? Any other information relevant is here? Methacholine. No, methacholine cannot be the answer, because methacholine is not a muscle relaxant. So this is completely ruled out. So methacholine is completely ruled out. Okay, there was a one question before oral surgery to relax oral muscles. Okay, question is before oral surgery to relax muscles, which drug is used? Okay, then it's a straightforward question. Before the oral surgery, which drug is used to relax the muscles? So there was an option glycopyrrolate. No. Glycopyrrolate is used to decrease the secretions. This is used to decrease the secretion. Methacholine is used to increase the salivary secretion, like in case you want to do the testing of salivation, right? So before oral surgery, which drug is given to relax the muscle? So here the answer is mevacurium. So I didn't get the exact feedback of this question, I told you. So mevacurium is the only drug here which is a skeletal muscle relaxant. So it's very easy question, straightforward question. So thank God this question was so much straight. It's easy to find out the answer. So mevacurium is the answer because this is the only muscle relaxant given in the question. It was the only muscle relaxant given in the question. They didn't ask the question on the duration of action of the muscle relaxant. So mevacurium is the only option. It's used. It's one of the short-acting muscle relaxant. It is one of the short-acting muscle relaxant rapidly metabolized by pseudocholine esterase enzyme in body. So whenever we have to do the daycare surgery, whenever we don't want to admit the patient, we are not doing some major surgery, we are doing some minor surgery, so we can use these short acting medicines like mevacurium. So question number 14, answer is A is the only drug given in that MCQ as a muscle relaxant. Now patient is undergoing some oral surgery, right? And during oral surgery patient has developed uncontrolled bleeding. So patient has got uncontrolled bleeding during oral surgery. What is the next step to do? So guys, the patient has got uncontrolled bleeding. Now, for this uncontrolled bleeding, ice application is something conservative method. It's a conservative method. This is not going to stop the bleeding. So here we have to give adrenaline. So 1% adrenaline can be given in this patient to stop the bleeding. I don't know the other options. In case you know the other options, please let me know. But according to students, the other options were easy to roll out. So other options were easy to rule out in the MCQ. So there were only two options in which students got trapped. One was the ice application. The second was the 1% adrenaline local application. So guys, local application of adrenaline, it will act as a vasoconstrictor. And when it will cause vasoconstriction, it will stop the bleeding, right? So it will stop the bleeding. So it can stop the bleeding. So 1% adrenaline can be given. So ice application will not solve the purpose. So 1% adrenaline can be used. Other options I don't know because I got only this partial feedback. So after question number 11, whatever questions I'm displaying, I have got half of the information. Okay, there was an option of pressure application. One option is of pressure application. Number 3 option. Number 4 option. The pressure application will not solve the purpose. Na? Like this is not going to solve the purpose. You have to do something significantly. So again, the answer will be the adrenaline. I think this question would be there in oral surgery recall also. Like if you have watched the oral surgery recall, ma'am, Dr. Imani must have taken this uncontrolled bleeding wala part. Okay, so guys, in case you come to know, according to me, the answer is still here is adrenaline. But in case you come to know about other options, please let me know. Now, question number 16. There was a patient presented with tooth infection, suspected to be caused by anaerobic bacteria. I'm still doubtful whether this question was there or not. So, tooth infection suspected to be caused by anaerobic bacteria. Now, which of the following can be given? So, metronidazole is a drug that is used. So, metronidazole is a medicine. So, metronidazole is a medicine that can be used against anaerobic bacteria. So, this is the medicine that we can use against anaerobic bacteria, right? So, question number 16, metronidazole given for anaerobic bacteria as well as given for gram-negative bacteria. So, whenever you have the infection of the tooth, right, you can use this medicine metronidazole. Uncontrolled bleeding post extraction. Okay, uncontrolled bleeding post extraction. It was not during the surgery, it was post extraction. After doing the extraction, patient has got bleeding. Now how we can control? Okay, now guys, this question will go to then because I can see in this question 15 there is only one option based on drugs. We have the other three options where we have to do the clinical maneuver. So I think whatever Dr. Himani or your oral surgeons will say, that is going to be the best answer because I will not touch this question because this question is, I think, more or less because of the other subjects, right? So I'll leave this question for oral surgeons, right? So these are the 16, 17 questions. 17th question was also there. So many questions are asked this time. 17th question. A patient has come to you with pain in the jaw and it is suspected to be neuralgic cause. So which of the following drug is given for the treatment? So which medicine is given for the treatment if a pain is due to neuralgia? So this, I think there was a history of trigeminal neuralgia. So according to some students, there was history of trigeminal neuralgia given. So again, a question from central nervous system. So trigeminal neuralgia history was there, and they asked you which medicine is useful. So the answer is like, what is the drug of choice for this trigeminal neuralgia? Answer was carbamazepine. So carbamazepine was the drug. I don't know the exact language of the question, but there was a history related to the trigeminal neuralgia. Patient is getting uh, pain in the facial region. So they asked you which medicine is the best medicine to be given. So carbamazepine is the medicine that is used, right? Carbamazepine is the medicine that is used there, right? And there was a student who was saying, sir, there was a question on the HIV drugs also. Like they ask you which of the drug is not a reverse transcriptase inhibitor. Is this so? Was there a question based on this question like this way? Ki which of the drug is not a reverse transcriptase inhibitor? Was there a question based on this? Okay, the venture man has said there was a history of sudden throbbing pain. So patient has got sudden throbbing pain. Where? I mean, was the history of facial region? Triggered on shaving. Okay, patient has got throbbing pain that is triggered on shaving. Very good, guys. Now this is going towards shaving of face, I think. Na? I mean, shaving of the beard, right? Not anywhere else. So shaving of triggered by shaving. So carbamazepine is the drug of choice. Carbamazepine is drug of choice. This is trigeminal neuralgia history was there. Now HIV question, which drug is not a reverse transcriptase inhibitor? So guys, there was a drug given in that question which ends with the word navir. I don't know which drug was given there, which ends with the word navir, like ritonavir, I think was there. So any medicine that ends with the word navir is a protease inhibitor. So that medicine is a protease inhibitor, that is not a reverse transcriptase inhibitor. So if this question was there, so any medicine that ends with our navir is a protease inhibitor, that is not a reverse transcriptase inhibitor. So this is clearly based on the, yes, ritonavir was there. Yes, very good, Dr. Sayyed. Thanks for this input. So ritonavir was the drug. It's not a reverse transcriptase inhibitor, because all medicines that end with our navir is protease inhibitor. So it was an easy, straightforward question based on HIV guidelines. So guys, you have noticed the questions have come from antimicrobials, like they have asked antivirals, antifungal. They have asked the protozoa also. They asked the bacteria also. Central nervous system is something they have asked like anything. Acute medical emergencies, like how to manage medical emergencies, they've asked like everything. Like they asked the medical emergency of respiratory system, autonomic system, cardiovascular system, all systems, acute medical emergencies they have asked this year. So this is something which is very important. Abacavir. No, Abacavir is the exception. Abacavir is not ending with the word navir. You can see Abacavir is a reverse transcriptase inhibitor. Okay, so according to Dr. Rahul, the options are Dr. Falak, tenofovir. So tenofovir is a reverse transcriptase inhibitor. Nevirapine. Nevirapine is also a reverse transcriptase inhibitor. And ritonavir is protease inhibitor. So these are the drugs you can see. These medicines are reverse transcriptase inhibitor. Abacavir, tenofovir, nevirapine. Only the ritonavir is the drug that is a different medicine. Here the name ends with the word navir. So any drug that ends with navir is a uh, protease inhibitor. So guys, these are the total 17 questions, and you can see many of the questions have come from our notes only. So just for the sake of your information, it's it's delighted on our behalf that we are launching this advanced plus package for you people. It's a dental app that we have there, where we have the pre-recorded videos. So we have recorded all our lectures over here. Around 600 plus hours lectures are there. Now, not only videos, guys, we will also have some extensive question bank for you. So like in case you do this question banks, all the emergency medicines will be covered over there. 20,000 exam relevant questions will be there. And also we have some test series. So along with this PYQs, competitive test series, we have the recorded lectures. Plus we have some clinical word for you, like they will give you clinical cases. You'll get notes also, revision videos. So much like full package you can say. You will have the full package in this advanced plus dental package of the app. And guys, in case you have any doubt in pharmacology, please message me on this number. This is a WhatsApp number. In case you have any doubt regarding pharmacology, you want to know any drug, you want to know any question, then I would love to answer your queries, right? Okay, angry baby syndrome. Angry baby syndrome. Okay. HIV question was angry baby syndrome with paradoxical excitement. Angry baby syndrome with paradoxical excitement. This is barbiturate, paradoxical excitement. So angry baby syndrome with paradoxical excitement. So barbiturate was there or not? Like phenobarbital, this was the option or not? So barbiturate may be the answer. So angry baby syndrome, because we can use anti-anxiety drug for the angry baby syndrome, or paradoxical excitement is taking place. So phenobarbital. Okay, phenobarbital was there. So phenobarbital is the answer. So phenobarbital is the answer. So question 18 or 19 questions are there from pharma. Why they are asking so many questions for pharma? Like 17 we have discussed, two more, like one is of HIV drug, one is of this phenobarbital, angry baby syndrome. So phenobarbital is the answer. Dr. Anil is saying in HIV question, they are not asking the reverse transcriptase inhibitor. They are asking which medicine will not act on nucleic acid, nucleic receptor, which will not act on nucleic receptor. Okay, so guys, HIV drugs so receptors pe they don't act. So I think the question is on reverse transcriptase enzyme. I mean, we have to check it again because there is no HIV drug that will act on nuclear receptors. So we have the reverse transcriptase inhibitors. So guys, these are the questions. In case you come to know or you will try to, you can recall any other question, please message me on this number so that I would also have this collection of all these questions which I asked in your NEET PG exam. Okay guys, take care of yourself. Now it's a time to enjoy your life. Yeah, बहुत हो गई पढ़ाई. It's a time to have fun, enjoy your life, right? And I hope and I wish a very uh, like my wishes are with you for your results. I think I wish that all of you clear your exam with the flying colors and you will get your seat of your choice. Take care of your guys. This side, Dr. Saurabh, your pharmacology mentor at DBMCI. Good night.